I'm Dr. Scott Needle. I'm a general pediatrician, primary care, affiliated with an FQHC in Sacramento, California. The question that comes up, particularly for us as pediatric providers, what do we tell parents? How do we advise them to be prepared? And the good news in this aspect is that there are a number of resources that are out there. The AAP has a family readiness kit, which you can find online. The Red Cross is a wonderful resource. FEMA is another great one with their ready.gov website. They even have a section of it called Ready Kids, specifically talking to children how they can be prepared. No matter which resource you go to, though, they're all going to be saying pretty much the same thing. And it's very straightforward, very simple. It's have a kit, have a plan, and be informed, know the risks. So let's talk about each of these three things very briefly here. So the first, in terms of having a kit, you want to have some kind of either a go bag or a container. And the reason for this is if you're in an area where you may be experiencing something like a hurricane, where you have a couple days notice, you can perhaps take your time, you can go around, you can gather all the things that you need. On the other hand, if you're in an area where there's a little to no notice event, such as a wildfire, which can come on incredibly quickly or almost suddenly in the middle of the night, you have to be able to basically grab your stuff, get out the door, and go. So there are a number of resources. We're not going to go through the entire list here, but it's important to know what are the things that you need, what are the things that are going to be irreplaceable and or to get you through the next few days so that you can start to recover and rebuild. A couple of the important things to point out, though, you want to make sure you have medications, and you want to make sure the families you talk to, if they can get refills, if at all possible, ahead of an event there. You want to get kids involved and talk to them in terms of what's going to comfort them, what kind of support things do they want to have that are going to occupy them and make them feel better in a stressful time such as this. And you don't want to forget your pets either in terms of the supplies, the food, the water, the bowls, the crates, these sorts of things as well. In particular, something that's changed from past years due to COVID is we're also asking people to have masks and sanitizer and wipes in their go bags there in case you're on the road and you need to still be taking measures to protect yourself from the pandemic. So put your kit together. You don't have to do it all at once. You can take some time for it there, but it's important to at least start putting things together and having it ready. And then the second element is having a plan. And there are a number of parts to this here. Again, you want to involve children. You want to involve families as a whole. You want to have the medical records, the medical information, and maybe store it on your smartphone as a picture so that's always there with you there. Talk to kids. Make sure that they know their names, their IDs, their telephone numbers, the telephone numbers for their parents, for caregivers. They can recite their address. Even kids as young as 4 and 5, sometimes even younger, can give this information to an adult if you happen to get separated. And you want to at least start to think through, if you do get separated, how are we going to contact each other? Is there going to be a place in the community that we can meet? Who are the other adults that you can reach if you can't reach us, for instance? Again, the conversations that you want to be having ahead of an event here. Again, the way that COVID is impacting things is in terms of evacuation and shelter. So if you do have to take to the road, how are you still going to keep yourself safe from the virus? And a lot of communities are altering their shelter arrangements from previous years. The idea being that if you have a lot of people in an enclosed space, that is not necessarily going to be safe from an infectious standpoint here. So things to keep in mind during the time of COVID. And then the third and last element of being prepared is being informed. Know what kind of resources are out there, where you can get information, who can you trust. Some of these you can actually put apps on your phone that can alert you when things are taking place. Ideally, you want to have multiple sources of information, including, for instance, having a battery-powered radio that you can tune in and get information from there. I would also say for us as pediatric practitioners, consider using social media, using your institution as a resource for getting information out there in the community. We've seen from past disasters that people look to us as providers as a trusted source of information, and they also look to online sources as opposed to sometimes the more traditional sources of media. So we can be a positive influence in terms of getting out proactive messaging and keeping people informed as a trusted source.